Well, Les Roberts is on the line with us this morning on the show. He is Associate Clinical Professor of Population and Family Health. He's been a guest on the Charles Goyette Show in the past. He's worked as an epidemiologist for the World Health Organization. He did that during Rwanda, the civil war in Rwanda. He also wrote that medical journal article in the Lancet about the excess deaths following the invasion of Iraq, put the number at something like 655,000. So we go to him for some direction and some guidance. Dr. Roberts, good morning, sir.
Charles, it's great to be back with you again.
It's such a pleasure to have somebody knowledgeable available to us on the show. What was your reaction to the World Health Organization estimation?
So now the Iraqi government themselves, the World Health Organization didn't do this. They just helped analyze it and write it up. It was done by the Ministry of Health and the Statistical Bureau of Iraq. So it was done by government workers. And now they're saying the death toll from violence in that exact same window that we looked at was 151,000, as you said. But they also said that there was maybe 300,000 extra deaths from nonviolent causes. So, first of all, the two studies are actually not differing very much about how many people died. One is saying 400 and something thousand. We said 650,000. The thing they differ about is whether most of that increase was from violence, and that's what our study concluded, or only 1/3 of the increase was from violence, and that's what this new study put out in the New England Journal of Medicine last week is saying.
All right. So if they exclude a big portion of the post-invasion deaths from their estimation, they're saying that they died of what? Malnutrition, lack of access to hygiene, clean water, hospitals, and so on, so they weren't violent deaths and they don't count?
That's exactly what they're saying. And on one hand, I suppose, in a very, very narrow, strict sense, one can say, well, those things are not any one person's fault. No one intentionally caused the health system to break down, caused the water supplies to stop working, and so on. But on the other hand, if we think about the 9/11 attacks, someday, I sure hope Osama bin Laden is on trial for it. He's going to say, you know those firemen that ran into the building, those hundreds of firemen? They weren't our targets. We didn't kill them. That was an indirect consequence. And I think that there is a slight danger of us seeming a little bit callous to focus in a narrow way on just those deaths caused by bullets and bombs. This venture had a human cost, and it's only in our interest as a society to figure out what those total costs were. And now an interesting aside is there are these two scientific studies coming to different conclusions about how much of it was violence, and over the course of time, scientists will poke holes in both studies and probe and probe and probe, and we'll learn from this discrepancy. But this discrepancy is quite minor in terms of, as you said in your intro, how society should view this venture and how we should move forward from here on.
But it sounds as though the puppet government is responsive to pressure to keep the sort of the shock and awe, the direct war death toll numbers down for some reason.
Now, there are two possibilities for this discrepancy in how many violent deaths occurred in that first 3 years of occupation. One is we're overestimating, the other is they're underestimating. If we did a little survey there in Phoenix and wanted to know how much extra unclaimed income were people getting, the University of Arizona could do it, and they might come to one conclusion, and the IRS could send people out to knock on doors, and they might come to a different conclusion. And my strong suspicion is that people were reluctant to tell these government workers with their government ID badge that my son was killed in a violent clash. So I just think that official government folks doing this survey, they might have done it well. They might have recorded what was said to them honestly. I am not saying that there's anything falsified. I'm just saying there would be a logical, natural tendency for people to underreport violent deaths to the government. And by chance, they didn't ask for death certificates to confirm the cause of death in this study, and we did. So I think history will bear out that our results are more in keeping with evidence from other sources.
Well, I note as well, a little out of my area of any expertise, but that they employed apparently in their analysis a steady rate violence during the years 2003 and 2000 to 2006, and you note that that wouldn't have been perhaps the best methodology because there was a dramatic increase.
Actually, they didn't like apply. That's actually what they found. In the reports of deaths, violent deaths to them, they found no difference in 2006 from late 2003 and 2004, and that's just not in keeping with data from the Baghdad morgue, data of burials in the city of Najaf, where the Shia traditionally try to take bodies for burial. In our data, in the data that the Pentagon keeps, not on deaths but on attacks per day, there was a dramatic increase right through 2006, and that is another reason why I strongly suspect that there was gross underreporting of violent deaths to these government interviewers.
All right. The other issue has to do again with the term about violent deaths. The Geneva Conventions prohibit the targeting of civilian water treatment facilities, for example.
That's right.
And so to the extent that those are contributory factors in the death of a large number of people, then that seems very clearly to be war deaths.
That's absolutely correct. In fact, there's a general agreement that we attribute the number of deaths to a natural disaster or to a war by comparing the death rate after with the death rate before. And when a couple of years ago we had a really bad heat wave that hit Chicago and maybe a couple of years before that Philadelphia, and we attributed a certain number of deaths, that wasn't all people that died of heart attacks and strokes. That was the number of dead above the normal rate of deaths that we see. And so that's a pretty standard approach, and it is, I think, suggesting again that this study looking just at violent deaths was perhaps underplaying the magnitude of the problem.
The other thing, and I don't know if you've had an opportunity to look at it, but you can't have 4 or 5 million refugees, internal and external refugees, without the death toll from that going up.
That's right. Or you can't have whatever we're up to now, 700,000 orphans in a country, and think that only 100,000 people have died. That's right.
Oh, my God.
Yeah. And as you said in the beginning, at this point, it does not matter. Let's take what I think the Pentagon spokespeople now would consider the most favorable number they could put out. Let's just accept this new Iraqi government estimate that in that first 3 years of occupation, only 151,000 died. If the American people knew on the eve of the war that many people would have died, I think there would have been near universal opposition to this venture. And it is, I think, just bad for our souls and bad for our collective wisdom as a democracy that's constantly learning from its mistakes to in any way diminish this horrific statement just because it happens to be somewhat lower than a statement someone made earlier on.
Yeah, and in fact, if you apply that percentage of deaths across a population base of the United States, I mean, the scope of the horror and the carnage is just it's frightening.
Yeah, that would be what about 15 million?
Jeez.
Closer to 20 million deaths. That's right.
That's a lot of 9/11 events all rolled up.
Absolutely, absolutely. And a really lovely thing happened after 9/11, if you recall, that when you walked into a store and you bought something, everyone said, "Are you okay?" And they looked you in the eye, and they really meant it. Just for a few days, it was like that. And it was because there was a sense that we collectively had been assaulted, and we felt a sense of community as a result. And to even take these new, lower numbers and accept that there was a 9/11 attack per week over years in Iraq should give us some sense to just what happened to the fabric of that society.
All right. One call before we exhaust your patience and our time. Paul, the cab driver. Paul?
Yes, sir. In our observations of American military deaths, we're seeing a ratio of 2.5 to 3 soldiers seriously maimed or seriously injured to every death. Has anybody taken into account how many Iraqi civilians have been seriously injured or maimed, and is that ratio about the same, or is it worse, or what?
That is a great question. And in this last survey that we did in 2006, we also asked, has anyone in your family been injured badly enough to go to the hospital from violence? And another poll done just last year did the same thing, and both studies found more people killed than injured. It seems that a lot of the people who are killed are executed. They are people that are walking home after work, or they're people that were picked up and kidnapped. And I just think that given that the main mechanism of death is gunshot wounds at very close range, that there aren't a lot of injuries in this war compared to other conflicts or compared to our soldiers who are probably dying more from explosives than from bullets.